Hello, student. Once again, I come to you with Obeng series. Today, we are coming to learn something very important in eye care. And as students, whether you are a resident or medical student or any health professional, or even nurse, you should know the gross anatomy of the eyeball for better understanding of what happens in the eye. To set the ball rolling, I want to say that this is concentric layers of the eyeball. It's showing concentric layers of the eyeball. But before I delve into it, this is the optic nerve, which we said transmits information from the eyeball to the brain. So the brain will be there, all right? And these are extraocular muscles. But let's talk about the concentric layers of the eyeball. There are three major ones. We have the protective layer, which is the most external one, made up of the sclera and then the cornea. The sclera, which is whitish, and then the cornea. Okay, so before we even continue, let me tell you about the measurements of the eyeball. So, at birth, the length of the eyeball is 16 millimeters. The length of the eyeball is 16 millimeters. By age 3 years, the eyeball will have achieved a length of 23 millimeters. And the longest measurement of the eyeball is achieved during puberty. So the diameter of the eyeball is 24 millimeters. 24 millimeters. What's the normal length of the eyeball in the adult? It measures is a range between 21 to 26 millimeters. On the average, the eyeball is 23.5 millimeters in length. Coming back to the concentric layers, as I said, there are three major ones. The most external one being the sclera and the cornea. The inner one is known as the vascularized layer. It's known as the uvea. The uvea, it gives nutrition to the eyeball. And then the inner aspect, concentric layer, is known as the retina. The retina. So the most external portion of the eyeball is known as the sclera and the cornea. 4/5 posterior of the protective layer is made up of the sclera, whereas anterior 1/5 is made up of the cornea. So the cornea is transparent, as you can see, it's transparent so that it will permit light to enter into the eye. Why is the sclera and the cornea considered as protective layer? One, because they are found at the most external, they are the most external layer of the eyeball, and then two, scientifically, they are rich in tough substance, very strong substance that give them protection. These are known as collagen fibers. Cornea is rich in collagen fibers, one, but it may also be rich in five and others. The sclera is rich in collagen fiber 1, or we call it type 1 collagen fiber. It gives the sclera the strength, elasticity to protect the eyeball against external invasions. So then we have the uvea. I'll show you in other slides. Okay. All right. So remember, let me show you here. This is the sclera. The most external part is whitish in color and quite resistant because it's rich in type 1 collagen fibers. This is the sclera. That is the sclera, the whitish layer of the eyeball. Okay. That is constituting 4/5 posterior of the eyeball, 4/5 posterior. So of course, anterior 1/5 is formed by the cornea. And we said the cornea has a lot of collagen fibers that make it resistant and protective, but notable amongst them or prominent among them is collagen type 1 and type 5 collagen fibers. So that is the cornea. It has outward convexity and it is transparent. So the middle layer is known as what? The vascularized layer. Look at the vascularized layer. Look at the vascularized layer, concentric layer, vascularized. That's known as the uvea. Uvea is made up of a lot of blood vessels that give blood supply to the eyeball. So we call it uvea or the vascularized concentric layer of the eyeball. And the most interior part of these concentric layers is known as what? The retina. What does the retina do? It is rich in photoreceptors. Photo and receptor. Photo because it captures light from the environment. Receptor. So photo because photo is light. Receptor, it receives. So photoreceptor. So there are cells within the retina that captures light from the environment, which helps us to see. So that's where the photoreceptors are found. This is the retina, the innermost layer of the concentric three layers called the retina. It contains the photoreceptors. They help us to see. That's why they contain the photoreceptors. So again, I want to show you the three concentric layers of the eyeball. The most external layer is known as the protective layer. Before I forget, remember this is the optic nerve which sends information to the brain and brings information from the brain to the eyeball. So remember that the most external layer is called concentric layer, is known as the protective layer. For fifth posterior, of this protective layer and most external is whitish, and that is known as the sclera, rich in collagen fiber 1 or type 1 collagen fibers, and that makes the sclera very strong and protective against external invasion. So it gives protection to the eyeball. So anterior 1/5 of the most external protective layer is made up of the cornea. It is also a protective layer because it's made up of collagen fibers 1 and 5. There are so many of the collagen fibers within the cornea, but it is of importance to mention collagen fibers 1 and collagen fiber 5 or type 1 and type 5 collagen fibers. So that's the most external concentric layer of the eyeball. So the middle layer, concentric layer, is known as the uvea. This is it. It's known as the uvea. It is a vascularized layer. What does it do? It gives nutrition to the eyeball structures. And then we come to the innermost layer. Okay, it is called the retina. It helps us to see. So something which helps us to see is of so much importance. That is why before it there is the uvea, and covering the uvea there is a stronger layer which is known as what? The sclera. So the innermost part is called the retina. It helps us to see. Why? Because it contains the photoreceptors, those cells that receive light into the eye for us to see. And after the photoreceptors have received the information from the external environment, they send the information through the optic nerve to the brain. And sometimes the optic nerve also collects information from the brain, brings it to the eyeball for us to see well. So that's it, your cornea, okay, and then your sclera, the middle layer, which is the uvea, okay, and then the innermost layer, which is what? The retina, photoreceptor layer. Now let's learn about the transparent layers of the eyeball through which light passes to go and stimulate the photoreceptors on the retina. Remember, if these layers of the eyeball were not transparent, how would light reach the retina to stimulate the photoreceptors for us to see well? It's logical that the structures must be what? Transparent to allow passage of light to stimulate the photoreceptors on the retina. So let's start from the cornea. So this is the cornea. It has outward convexity. So that is the cornea. It's transparent layer of the eyeball. Okay, as I've shown in another slide, that is the cornea. Okay, so we are going into the eye. So, and the brownish structure you see is known as what? The iris. Is known as the iris. Is known as the iris. That's the brownish structure you see posterior to the cornea. Okay, you see the brownish structure is known as the iris. Remember, at the center of the iris, there's a hole. Look at the hole, a black hole at the center of the iris. This is known as the pupil. Pupil. This is known as the pupil. That is the hole which is found at the geometric center of the iris. Okay, but remember, between the cornea and the iris, there is a space. Okay, between the cornea and the iris, there is a space over there. Okay, that space is known as anterior chamber. Anterior chamber. For that space to remain the way it is, it contains a liquid, a fluid, and that fluid is known as aqueous humor. Aqueous humor. Aqueous humor. Okay, so that is the cornea and this is the iris. Between the cornea and the iris, there is a space, and that space is known as what? Anterior chamber. There's a space, there's an opening, okay, there's a chamber, there's a room. So that particular chamber is known as what? Anterior chamber. So I repeat, this is the cornea, that is your iris. Between cornea and iris, that space there is known as what? Anterior chamber. And the hole which is found at the center of the iris is known as the pupil. Remember that during your rotations, you will be using some medicine to open up the size of the pupil. Okay, it will measure on the average 3.5 millimeters, but when you put some medicine on the eyeball, it stimulates the dilator pupillary muscle. It contracts and makes the pupil become big, so it can go to 6 millimeters, 7 millimeters, and more. There are also medicines that can relax the sphincter pupillary muscle and prevent it from contracting, giving a lot of advantage to the dilator pupillary muscle. Okay, so that is your iris. So in front of the iris, we have what? Anterior chamber. So I usually tell my students that the iris is iris of chambers. Why? Because anterior to the iris, you have anterior chamber. So posterior to the iris, you are going to have posterior chamber. Let us look at this other structure, okay, for better understanding. Listen. So this is your cornea. It's transparent, okay. This is your cornea. It has outward convexity, all right. Okay, and the structure here is known as the iris. Okay, this is the iris, the brownish appearing substance grayish is known as the iris. Okay, the hole which is found at geometric center of the iris is known as the pupil. The pupil, the pupil, and the pupil. Okay, so between the cornea and the iris. This is space. This is space. All this space is known as what? Anterior chamber. Anterior chamber. What occupies this space? It is not air. It is not anything but fluid, liquid. That fluid which is found at the anterior chamber is known as aqueous humor. Aqueous humor. Again, as I said, the iris is known as iris of chambers. Iris of chambers. Why? Because anterior to the iris, we have anterior chamber. So posterior to the iris, you have what? Posterior chamber. So if I ask, what are the barriers of the anterior chamber? Okay, anteriorly you have the cornea, and posteriorly you have what? The iris. Here you are. So the anterior chamber has two major barriers. Anterior barrier is the cornea, and posterior barrier is the iris. Or if you want to make your answer more specific and academically accepted, then you say that, well, the barriers of the anterior chamber are posterior surface of the cornea, where the endothelial cells are found, and the anterior surface of the iris. These form the barriers of the anterior chamber. Now let's talk about the posterior chamber. The posterior chamber is found in between the posterior surface of the iris and anterior surface of the crystalline lens. This is the crystalline lens, okay? That when it becomes opaque, then we develop cataract. It becomes opaque and light can no more pass through. What the disease it causes is known as what? Cataracts, okay? So that is the crystalline lens. It's biconvex in nature, okay? That's the crystalline lens. You see, it is held in place by zonules of zinc, zonules of zinc, zonules of zinc. They hold the crystalline lens in place, okay, into the ciliary body. So you realize that they look like ropes, okay, that are attaching the zonules of zinc. They are found attaching the crystalline lens to the ciliary body, crystalline lens to the ciliary body. So this is a crystalline lens, okay? Where is the posterior chamber of the eyeball found? It is found, so we said the iris is iris of chambers. So the posterior chamber of the eyeball is found posterior to the iris. Specifically, it is found sandwiched between the iris and the crystalline lens. So that is the space for the posterior chamber. If you want to make your answer more academically accepted, then you say that the posterior chamber of the eyeball is found between the posterior surface of the iris and the anterior surface of the crystalline lens. Okay, so that is it. Please never call this lens. Do you know why? There are several types of lenses. Why? Lenses are put in cameras. Lenses are put in the glasses that we are seen wearing to make our sight better. Lenses are found in ophthalmoscope, being direct, indirect. Lenses are found in operating microscopes. So, how do you differentiate all these type of lenses from the anatomically natural one that is found in the eye? So we call this one crystalline lens. Why? Because it is made up of certain type of proteins, and these proteins are called crystalline crystalline proteins. So that is where it derives its name from. So we call it crystalline lens if it's the natural one which is found in the eyeball. So another picture is here to make you understand it better. Okay, so Here you have the cornea, which is transparent. Okay, it's transparent. More often than not, when you look at people, you think that the cornea has a color. It doesn't have a color. What you are seeing from the cornea is the color of the iris. Okay, but the cornea is transparent like this. It has an external convexity. So from the cornea, then you come to the iris. Okay, the iris is here. We said the iris is iris of chambers because anterior to the iris, you have anterior chamber which contains aqueous humor. It's a fluid found within the eye. Remember, at the center of the iris, at the geometric center of the iris, there is a round hole, and that hole is known as the pupil. It's known as what? The pupil. It keeps changing sizes. If there's so much bright light, it becomes smaller. If there's dim illumination, it becomes wider. In fact, several factors may influence the size of the pupil. So as we said, the iris is iris of chambers. So posterior to the iris, you have the posterior chamber. Okay. So what are the landmarks of the anterior chamber? The landmarks of the anterior chamber are the cornea anteriorly, and then posteriorly the iris and the pupil. So again, you should remember that the anterior chamber contains a fluid known as what? The aqueous humor. In that same way, the posterior chamber, whose borders include anteriorly the posterior surface of the iris and posteriorly the anterior surface of the crystalline lens, that is the posterior chamber, and it also contains aqueous humor. So from the posterior chamber, the next structure you meet, which is transparent, is not lens. We call it crystalline lens because it is rich in certain types of proteins known as what? The crystalline proteins. But holding the crystalline lens to the ciliary body is or are the zonules of zinc. Zonules of zinc. What are zonules of zinc? They hold the crystalline lens in place. So in a case of trauma to the eyeball, that trauma can tear, break, or destroy some of the zonal fibers and cause what we call subluxation of the crystalline lens. But if the trauma is so intensive that it's able to tear all the zonules, then we say the crystalline lens is dislocated. Alright, so remember, it is the crystalline lens that when it becomes opaque, then we say patients have developed cataract. Okay, we should also know, so let's revise a few times more. Three concentric layers of the eyeball. The most external one is called the sclera. Okay, the sclera constituting for fifth posterior of the eyeball. And then we have the cornea, which constitutes anterior one-fifth of the protective layers of the eyeball. Of note is the fact that the sclera is rich in type 1 collagen fibers, which is very strong and tough, giving the sclera the property of being strong and protective against external invasions. Of course, we shouldn't forget about the cornea, which is transparent and is also rich in several collagen fibers. Okay, but we should not forget to mention the most common ones, which are type 1 and type 5 collagen fibers. Remember, this is your optic nerve. So the next concentric layer, which is the middle layer or the middle coat, is known as the uvea. Okay, the uvea. Okay, so the uvea is the middle vascularized layer. It is said to be the vascularized layer because it gives nutrition to the eyeball. Remember, that the uvea has three major parts, okay, made up of the iris, the ciliary body, and of course, it's also made up of the choroid, okay? All right, so that is the uvea, okay, three major parts. So then the innermost layer or the innermost concentric layer is called the retina. What does it do? It helps us to see. Why? Because it contains cells that are known as photoreceptors. Photoreceptors, we have two major types, the rods and then the cones. Photo and then receptors. Photo means the light. Photorecept and receptor means receive. So photoreceptors are cells that receive light from the environment for us to see. How? After the photoreceptors capture the light from the environment, they help us to see, passing information through the optic nerve into the brain for processing. And after that, the brain brings the information back to the eyeball. So if you look at this picture, you realize that this is the cornea, okay? From the cornea, the most posterior layer of the cornea is known as the endothelium. The space here, all right? So, well, this is the iris, okay? At the center of the iris, you have the pupil. So from the cornea, there you go to a chamber in front of the iris. Because it's in front of the iris, we call it anterior chamber. The anterior chamber contains aqueous humor. Okay, because the pupil is an open space, it will also contain aqueous humor. So that is the iris. Okay, posterior to the iris, we have the posterior chamber. Okay, and posterior to the posterior chamber is a crystalline lens. So the barriers of the anterior chamber include the cornea anteriorly and then the iris posteriorly. The borders of the posterior chamber include the iris anteriorly and the crystalline lens posteriorly. So posterior to the crystalline lens is a structure known as what? The vitreous. The vitreous, okay, is the vitreous. All right. So the vitreous is fluid which is found between the crystalline lens and the retina. The fluid found between the crystalline lens and the retina is known as what? The vitreous. Okay, so that is your vitreous here. So let's go over. This is the cornea. Okay, anterior chamber. This is the iris, the pupil, posterior chamber, crystalline lens, the zonules of Zen. Zonules of Zen. Never call the zonules of Zen ligaments. Remember, ligaments are quite huge. They might be found joining two major bones. So don't call it ligaments, okay? Don't call it suspensory ligaments, okay? So remember that that's the crystalline lens here for you. So this is the vitreous. This is the vitreous, okay? There's a vitreous here. That's the vitreous. And posterior to the vitreous is the retina, okay? So that's the ciliary body for you, okay? So it is important to note that posterior to the vitreous is the retina. There is a retina, okay? There is a retina where the photoreceptors are found. So on the retina, this is your macula, all right? So this is the most anterior portion of the optic nerve and is known as optic disc. The most anterior portion of the optic nerve is known as what? The optic disc. So that is the optic disc, and this is the retina as a whole. Temporal to the disc is the macula. So this is the right eye and that is the left eye. Here you have the optic disc, which is found here. That's the most anterior part of the optic nerve. and this is the macula. That is the macula. Okay. At the center of the macula, you have the fovea. At the center of the macula, you have the fovea. So basically, that is it for the day. We've spoken about the gross anatomy of the eyeball. Students, keep subscribing, and I will see you in class. If you have any questions, you can put them down and ask me further. Thank you very much for your attention. Okay, I'll see you